equally or even more at risk compared to men. So now, if somebody asks females are, because they are being underdiagnosed, they are being investigated. And many people, the physical activity compared to men and women, men have more physical activity, women are less physical. So the development of symptoms is delayed in females. So diagnosis is delayed and it is underdiagnosed. Therefore, now the understanding is females are more at risk of cardiovascular disease. Now, the male risk is decreasing, the female risk is going up. They're overtaking the men. So now, females 43% and males 37%. The ratio is getting tilted. The balance is getting tilted. Even the risk factors, for example, hypertension, diabetes, smoking, the effects of risk factor is more in females. Suppose you take two ladies, both are smokers. Two ladies, one male and one female, both are 40. They don't have any other comorbidities. Both of them are smokers. The females have more the side effect related complications. The risk factor related complications are more in females. Both are smokers. Females will have more problems. Alcohol, females will have more problems, as we were discussing with the alcoholic liver diseases in females. So that is the understanding now. And females also have microvascular ischemic disease more than the men. Men have macrovascular. The epicardial, suppose this is the heart. I'll show you the model here. This is the heart. If they are the arteries, men will have more epicardial disease and women will have the microvascular ischemic changes for whatever reason. That's why females are at more risk of cardiovascular disease today. Even the diagnosis also is I don't know why it is different. Why Indians? That's a big question. Why females? That's another big question today. Why Indians and why females? Even if you do a TMT test, ECG also, ECG, TMT test, they have more false negative TMT tests compared to men. That's why we don't diagnose. It's underdiagnosed because of various reasons. So therefore, a physician should always be alert to pick up the diseases early. And one is primary prevention, secondary prevention, as we discussed yesterday. Primary prevention, secondary prevention. Primary prevention means you control the risk factors, smoking, diabetes, alcohol, hypertension. So a physician should always be alert to pick up the problem in the beginning before they develop a big disease. So if you take the history of the cardiovascular diseases, many times they are silent. Many times, you must have heard many stories. The person is absolutely all right till yesterday, and suddenly, middle of the night, he slept, middle of the night, he died. Or other patients, everything is fine. He goes to his workplace, office. During the working time, probably in the morning, 11 o'clock or 12 o'clock, suddenly he gets chest pain and he is brought to the hospital. He has a heart attack. So this is very common scenario that we come across in our day-to-day practice. So what is the meaning of this? Why should the problem come suddenly? Has it come really suddenly? No. It's a disease. The disease process is there for last 5 years or 10 years. It is manifested now. It has come out now. Therefore, if you can identify the risk group, he may develop a heart attack after 3 years or 5 years. That is the duty of physician. It's not just we are the social instrument. Doctors are social instruments. We are social tools. We have to. Prevention also is in our hands, our responsibility. Not just somebody coming with heart attack you are treating. No, somebody is coming with heart attack. Trace their family members. If any risk factors are there, his younger brother who is 5 years, 10 years younger to him, if he has risk factors, because cardiovascular diseases, they run in family, genetically. And this is the premature cardiac death. This is another disease. What is premature cardiac death? Anybody dying less than 45 years of heart disease In men, this is called premature cardiac death. In women, anybody less than 50 or 55 years dying of cardiac disease, these are premature cardiac death in females. So anybody has any in the family such kind of history, the remaining family members have to be very, very careful. Tomorrow I'll tell you one example of one family, one big family, very rich family stays here in Hyderabad. Their relatives are in Mumbai and Goa. One young girl, some 22-year-old girl, had some doubt. Her sister, who is about 26 or 27, who resides in Goa, married and planning for a family. So I just wanted to rule out, I don't know, something occurred to me, and I just, this was teleconsultation online. So I did her cholesterol was high, and there's a family history of the father's brother died at the age of 44 years. So I was worried. I was wanting to find out, is there any genetic disease that is running in family and nobody knows? So incidentally, unfortunately, to say that this girl, 26-year-old girl, has a high cholesterol, and I did a complete coronary risk profile in the form of lipoprotein little a, homocysteine levels, and other cardiac risk factors, markers. So her lipoprotein little a was elevated. And I immediately said everyone should get the test done. Her sister, who is staying in Hyderabad, she's only 21 and she's very puny, thin. So she also got tested. Her lipoprotein little a also is high. So this is a familial hypercholesterolemia. That's why this girl's uncle died at 44 years. So it is your responsibility, it is my responsibility to screen all the family members, and I've started anti-cholesterol treatment for these two young girls. So that is the responsibility of a physician. You should be extremely alert, vigilant throughout your life. So as I said, the patient can be asymptomatic totally, silent disease, or sometimes they present to you with acute problems of sudden chest pain or sudden breathlessness, or they can be subacute. The patient may say that I'm getting sometimes chest pain last 2 to 3 months when I'm climbing a stairs. I used to climb 3-4 floors without problem. Now when I'm climbing 2 floors, I'm getting chest pain. I have to sit for some time. I cannot continue climbing further. So this is happening. I thought I'm becoming old. That's why when I'm walking for some distance, I'm getting pain. And some